Hi! Have you ever heard about the deadly brain tumor called glioblastoma? What makes glioblastoma deadly? Glioblastomas are tumors that arise from astrocytes. These astrocytes are the star-shaped cells that make up the brain's supportive tissue. Glioblastoma, also known as glioblastoma multiforme, is a grade 4 type of cancer because it is highly malignant. They are very infiltrative and spread out into other parts of the brain. They have very fast dividing cells and they produce many growth factors that make blood vessels grow and help the tumor cells multiply. Glioblastoma does not metastasize outside the brain. It typically stays within the brain and tends to grow to other areas. Glioblastomas can occur in any lobes of the brain. It more commonly occurs in frontal and temporal lobes, but it can occur anywhere, including the brainstem and the cerebellum. Glioblastoma development is highly unknown, but it can occur at any age and tends to occur more often in older adults. The symptoms can range very widely from being silent and growing, and just presenting with loss of appetite, headaches, nausea, vomiting, and seizures. They can cause subtle personality changes, memory loss, changes in ability to think and learn, or depending on if they are near the parts of the brain that control strength. The tests and procedures used to diagnose glioblastoma includes the neurological exam, imaging tests, and removing a tissue sample for testing or biopsy. Furthermore, specialized tests of the tumor cells can tell doctors the types of mutations the cells have acquired. This gives doctors clues about the prognosis and may guide the patient's treatment options. Glioblastoma is very difficult to treat, and the cure is often not possible. Treatments may slow the progression of cancer and reduce signs and symptoms. Moreover, these treatments include the following. First is surgery to remove the glioblastoma. In this procedure, the neurosurgeon will work to remove the glioblastoma. The goal is to remove as much of the tumor as possible. However, because glioblastoma grows into the normal brain tissue, a complete removal is not possible. For this reason, most people receive additional treatments after surgery to target the remaining cells. The second is radiation therapy. Radiation therapy uses high-energy beams such as X-rays or protons to kill cancer cells. It is usually recommended after surgery and may be combined with chemotherapy. Radiation therapy and chemotherapy may be primary treatments for people who cannot undergo surgery. The third is through chemotherapy. Chemotherapy uses drugs to kill cancer cells. In some cases, thin circular wafers containing chemotherapy medicine may be placed in the brain during surgery. The wafers dissolve slowly, releasing the medicine and killing cancer cells. Furthermore, other types of chemotherapy may be recommended if the glioblastoma recurs. Fourth is the tumor treating fields, or TTF therapy. TTF therapy uses an electrical field to disrupt the tumor cell's ability to multiply. TTF involves applying adhesive pads to your scalp. The pads are connected to a portable device that generates the electrical field. TTF is combined with chemotherapy and may be recommended after radiation therapy. Fifth is targeted drug therapy. Targeted drugs focus on specific abnormalities in cancer cells that allow them to grow and thrive. The drugs attack those abnormalities, causing the cancer cells to die. And lastly, the supportive or palliative care. Palliative care is specialized medical care that focuses on providing relief from pain and other symptoms of a severe illness. Palliative care can be used while undergoing aggressive treatments, such as surgery, chemotherapy, chemotherapy, or radiation therapy. For the outlook and survival rate, generally, the treatment of glioblastoma begins with surgery, but because the tumors are spreading, they are difficult to remove completely without damaging other brain tissues. The median survival time is 12 to 16 months. That's the point at which half of those who undergo treatment do better and half do worse. Only 10% of patients live more than 5 years. Doctors are working on new treatments for glioblastoma and many clinical trials are underway. And as treatments improve, people newly diagnosed with these aggressive brain tumors may have a better outcome. And that's all. Hope you've learned a lot. Thank you for watching.